I want to go to one in the chat, actually. Basically concerned about the situation in terms of healthcare workers who have long COVID, the effect on the workforce, how it will impact on all of the mental health services, healthcare provision, further reducing staffing. What would candidates do to halt this vicious cycle and retain healthcare staff, ensure their health and well-being, and thus all of ours? Now, I appreciate that is possibly a national question more than a local question, but if you're looking at health and social care partnerships, it is around staff welfare and health and well-being of staff, isn't it? For them to be able to do their jobs to help people with COVID and long COVID. Yeah. Jackie, would you like to
Absolutely
go for that?
And if you remember, I did say that your councillors, some will be appointed to the health board, some will be on the health and social care partnership, so it's absolutely legitimate. I think the problem we've got is the understanding of the health service of this. So, you know, I don't want to go on too long, but my experience was right at the very beginning, I had a constituent who was a nurse who worked for Greater Glasgow and Clyde, and she was being harassed to go back to work because there were staff vacancies. She had long COVID, they didn't get it, and they hounded her to get back to work. Thankfully, that situation has changed. She was one of the first wave people. That situation has changed, and across Scotland, there is a policy in place where people are supported on full pay, there's special leave arrangements, and they're not hounded back into work. My fear is if the government changes the Fair Work statement, which I think they might do, we might see a return to the old practice. Because COVID's gone, so long COVID and everything else is gone. And we need to be vigilant to that and really nip that in the bud and stop that before it happens. I do think health is quite an interesting example. And let me give you an example of two people that I met. No, I'll just do one because of time. A 60-year-old who looked as if she was about 40. I was dead jealous of her, but a 60-year-old consultant geriatrician who said, I'm getting a bit old. I really can't do weekends anymore, but I'm happy to work during the week. They let her go. They let her take early retirement. They refused to be flexible at all. And I would rather retain 5 days of her expertise and her knowledge than simply die in a ditch over whether she worked weekends or not. There are people leaving the NHS who don't want to leave. You hear it in their voices. There's nobody conducting exit interviews to say, look, we don't want to lose you. What can we do to make you stay? And at an RCN conference, I met a woman exactly like that, who, if somebody had said to her, work 4 days a week instead of 5, she would have stayed. Okay, so we're losing that. We're losing nurses to bank nursing, you know, and we're not treating our staff well. So I get there are waiting lists and politicians care passionately about their constituents being seen. But unless we take care of the staff and support the staff, those waiting lists are never going to be addressed. And therefore, we need to take the time to talk to the staff, to provide them with the support they need, to get those who are off with long COVID, to get them into a pattern of, you know, very slowly and gradually returning to work, because I'd rather have somebody for 1 day with their expertise than no days at all.
Thank you. Some wise words there. Indeed. Alec, if you, I'm going to close quite soon, but if you've anything to add to what Jackie has to say.
Only in as much as to say that, look, COVID didn't cause this, but it compounded it. We were facing a staffing crisis in our NHS long before anyone had heard of COVID-19. And that's largely down to several things. Firstly, the inflexibility of workforce planning that Jackie's just laid out. Jackie and I should say, were, was it 2 weeks ago, Jackie? We're at a roundtable with RCN nurses, and it was heartbreaking to hear those stories of people who love the profession but being driven out of it because they can't afford to work, or they're not being given the flexibility to work, and the rest of it. Nicola Sturgeon, when she was health secretary, cut 300 nursing and midwifery training places. So she was worried about a glut. Well, we're not worried about a glut now, are we? And frankly, you know, those nurses that Jackie and I met at that round table were almost insulted by the fact that this is a nation that they're working in, which was quite happy to go out and clap for them on Thursdays on the doorsteps, but have now deserted them. And they have been working miracles on their knees. They've been weaving gold out of straw. So the Lib Dems want to do two particular things, or three particular things. Firstly, we want to recognise RCN pay demands. We need to be paying our health and social care workers far better than we are, make it professions of choice again. Secondly, we want to set up an NHS and social care staff assembly so that we can hear from them what needs fixed and ideas for change. And thirdly, we need a burnout prevention strategy. We need to recognise that a lot of these guys are still running on empty. A lot of them are suffering from PTSD, particularly those who are working in the COVID red zones and in the ITUs. That they are facing a mass, and they know there is a backlog of operations that have been cancelled coming down the tracks. It's a perfect storm. But again, I'm afraid the government seems to have their head in the sand.